Director of the Sarah Project and also the mayor of Milford, Pennsylvania. In Milford, for the last several months, we've been having a series of Ask the Doctor sessions where we update people on data concerning the pandemic, including local information, and then take questions. It's been a very broad range of topics. Here, as across the country and across the world, there's been lots of discussion about masks and the efficacy of different types of face coverings and all the nuances involved in that. And 6 weeks or so ago, some of us locally started using face shields, some instead of masks, some in addition to masks, and that seemed to be happening all over the country. And in April, at the end of April, Dr. Michael Edmond, who's one of our guests today, and two of his colleagues from the University of Iowa published an opinion piece, an editorial piece in the Journal of the American Medical Association, specifically addressing face shields. And Dr. Edmond can tell us better, but I get a sense that in the last 2 weeks, the discussion and focus and interest and in some cases debate concerning face shields and masks has reached kind of a new fever pitch with the Dr. Fauci's response to a question about shields last week, and Dr. Birx's comment, and there's an incident in Switzerland. So it seemed like a good time to have a call just discussing that. And we're very fortunate to have Dr. Doug Mannion, who has participated and is the sole participant, has been the star of our Ask the Doctor calls locally here in Northeast Pennsylvania. And our new guest, who has emerged as one of the real experts around the issues concerning shields, is Dr. Michael Edmond from the University of Iowa. I'm going to let each doctor briefly introduce himself, and then we're going to go to Dr. Edmond for his presentation. And after his presentation, Dr. Mannion will have a conversation with Dr. Edmond, just ask a few questions, have a little bit of a discussion, and then we will go to questions. In terms of questions, feel free to post them in the chat box anytime they occur to you. And I'll keep track of them and get them to the doctors and get them answered as we're able. And then we also probably will have time to take live questions. And you can use the raise hand function. If you click on the chat box, it'll show the list of the participants, and you have the option of muting yourself, or and there's a button that says raise hand, and you click on that raise hand, and then we'll call on people in order. But feel free to also put them in the chat box throughout the session, and we'll keep track of those. So with that, thank you, everybody. I hope you're not having as much of a storm where you are as we are here in Pennsylvania, where we're looking like we're going to be getting some flooding and high winds. But with that, I want to ask Dr. Edmond and then Dr. Mannion to introduce yourselves, and then we'll go back to Dr. Edmond for his presentation.
Hi, everyone. My name is Mike Edmond. I'm here in Iowa City. I am a professor of infectious diseases at the University of Iowa College of Medicine. And I also serve here at the hospital as the Chief Quality Officer for the health system. Happy to be here.
Thanks, Michael. I'm Doug Mannion. I'm a ID trained physician from Canada, where I trained, did a multi-year postdoc fellowship junior faculty stint at Harvard, where I taught at Harvard Med School for 4 years and worked in the retrovirology lab of Dr. Martin Hirsch. So my area of particular expertise is clinical virology. I currently run a small biotech company spun out of Yale University, and among the things we're developing is an anti-COVID-19 therapeutic. And I've been helping to advise the borough and the states of Pennsylvania and Connecticut in terms of ways to kind of counter this pandemic. And one of my main areas of focus now is how it is that we can safely reopen our schools.
Okay, thank you. I need to add one more note, which is that we will be recording this session, and then we'll make the recording available afterward and post it on social media and wherever. So keep that in mind with any comments you have to share. And Tammy, can you go ahead and start the recording? Tammy, you're on mute.
It is recording, Sean. I
Pardon
just
me?
realized that. We are recording. I just realized that I was on mute, but the
Okay.
recording has started.
Okay, terrific. So Dr. Edmond, if you can share your screen and go to it.
So do you see the full screen, Sean, or do you see like a split screen? You're muted.
Michael, we see a full screen.
Perfect. All right. So I'm going to talk for a few minutes about face shields, and this is an area that I became interested in really because I had to. This stemmed from early in the pandemic when we admitted our first patient here at the University of Iowa in the second week of March. And we started to look at what types of PPE that we had available. We became quite concerned that we might not have enough face masks to make it through the outbreak. Even though at the time we had several million face masks in inventory, we were concerned about how fast we would use them. And so we started to look at alternative ways that we could protect our healthcare workers. And that's how I became interested in face shields. So these are really very simple devices. There's really three pieces to them. There's the visor, which is that clear part that surrounds your face. That is attached to a frame at the top. And then the suspension part is the part that on some face shields can be tightened to make it fit appropriate to your head. I get asked a lot of questions about face shields in terms of what kind of face shield should I buy or what should I be looking for to get the most protection out of the face shield. There's really only a couple things that you need to look for. The front of the shield, that clear plastic part, should come down to at least the level of your chin, or if not a little bit below that. On the side, it should come back to the point that it's nearly to your ear. And then the other thing to know is that from your forehead to the shield, there should not be a gap. Some of the early 3D printed face shields have a gap between your forehead and the shield, and that could allow droplets to come down onto your face. So you don't want to have a gap there. You also need enough clearance so that for people who wear glasses, the shield doesn't hang up in your glasses. And if you're going to wear a mask underneath of it, you need clearance for that as well. But most shields are designed to do that. Often they have about a 1-inch thick piece of foam rubber that touches your forehead, and that gives you enough space so that you can wear your mask and your glasses. There's all kinds of face shields out there now. On the left, you see more of an industrial type face shield. You can find face shields like this in hardware stores. These are designed to be used for things like metal grinding and woodworking, but they can work just fine to protect you from COVID too. The two on the right-hand side of the screen are more like what you might see in a healthcare setting, or you could wear these. These are ones now that are just commercially available that you could purchase. This is a newer face shield that I show because it has a very unique shape to it. It's shown in an opaque version here so you can get a good feel for what this shape is. But what's really nice about this particular shield is that it actually comes under your chin. So you get protection there as well. And this is a picture of me making rounds at the hospital a couple of weeks ago wearing this particular type of face shield. And these sell for about $1 a piece. They were designed at Harvard. And I think they're really very comfortable because they weigh nothing essentially. There are some other special kinds of shields that you can find. There are shields that are designed to fit onto a baseball cap. There are shields that are made for children that are fun ones in children's sizes. There are just many different types available. I have a blog, and on my blog, I have a post where I've aggregated about 100 different websites that you could order face shields from. And there are as many types as you can imagine. The advantages of shields are that most people will find them to be more comfortable. And one of the reasons is they don't feel as hot as a mask does. Some people that have claustrophobia have problems with masks, so they like face shields better. There is no impact on your breathing resistance. So if you feel short of breath in a mask, that doesn't typically happen when you're wearing a face shield. Importantly, they keep you from touching your face. And we really don't want you to touch your face, because if you had touched a contaminated surface and you have virus on your hands, we don't want you to infect yourself with the virus. One of the problems with face masks is that people, at least some people, will touch their face even more than in the normal setting because the mask may feel itchy or they feel like they have to adjust it. And that's something we just don't want people to do. Another important feature of face shields is that they protect your eyes. And that's important because we know that the receptor for this virus is found on the eyes. So if you were to get the virus onto your eye, you could become infected. And there's an animal model that has proven that. So the face shields do give you eye protection. They're easily disinfected. All you got to do is wipe them off. You can do it with soap and water. You can do it with any household disinfectant that you have. So that's also a nice feature of them. There's no impact on your speaking, and it doesn't impede your facial nonverbal communication. We have heard from a number of people who are hearing impaired, who really are having difficulties with other people wearing face masks because they really are reliant on the ability to see people's lips moving. It's more likely to be worn correctly than a face mask. It's kind of hard to mess up the face shield. I mean, once you put it on, it's on. So it usually will do its job without much problem. And for those of us who work in healthcare, there's probably less anxiety associated with shields because the patient can see my face as opposed to a mask. There are a few disadvantages. Some of and it just depends on the product, but some of these products you may get some glare. They may not be optically perfect. The industrial shields, like that first one that I showed you, are bulky. And if you're wearing them for long periods of time, they can get heavy, and some people get neck pain from wearing those. And you just don't get the same fit on the outside edges as you do with a face mask. And there is some concern about whether you could get infected with something coming around the edge of the shields. So as Sean mentioned at the outset, with two of my colleagues, I published a viewpoint in JAMA, and it was talking about using face shields in the community. This had been after we had implemented a face shield program at the University of Iowa hospitals and clinics. We have all 13,000 employees in our hospital, both clinical workers and non-clinical workers, everyone every day in a face shield. So we have now a fair amount of experience with shields. And once we got to the point where we had accomplished this in the hospital, we began to think about whether there would be utility of using these devices outside the hospital. And we wrote this piece. And it's based on the fact that it appears that the primary mode of transmission for this virus is through droplets. And face shields are great for droplets because they catch them as they come at you. There's some experimental data that I'm going to show you here in a few minutes that supports why we want to do this. The other nice thing about face shields is that, as opposed to medical grade face masks, the supply chain is good. So we were able to get face shields even at points in time when we weren't able to get medical grade face masks in the hospital. I'm going to just talk about a few of the studies that in the blue here. These are studies that really would mimic what happens in the community. The other studies on this slide I'm not going to talk about because they're very specific to surgical situations inside the hospital. But there is a study that used a cough simulator, and that cough simulator contained fluid that had influenza virus in it, and then it would shoot out of the cough simulator against another mannequin that had on a shield. And the idea was to see how much could we reduce the amount of virus that you would be exposed to. And it depends on the size of the aerosol that's created. The 8.5 micron aerosol these are larger droplets, and it reduces the amount of virus that the mannequin saw about 96% when that cough is occurring about 18 inches from you. At 6 feet, it's about a 92% reduction. If you make the aerosol smaller, it's about a 68% reduction at 18 inches. And then there's a fluorescent dye spray. In this case, the aerosol was 5 microns. And what they showed was that if the mannequin had on a face shield, there was no contamination of the eyes or the nose or the mouth at about 20 inches from the spray. So this is some laboratory type data that would support the use of face shields. There's also an observational study from Hong Kong, a large hospital there, that looked at nurses, and they found that when nurses wore face shields, they had an 88% reduction in developing a flu-like illness. So this is just purely observational. This was a statistically significant finding, and suggests that face shields do have utility. This study here just came out. It's not published yet. It's in preprint, which means that it has not been peer reviewed. So you can't, I wouldn't put a lot of emphasis on this paper. I think the results of this paper are very, very interesting, but until it's peer reviewed and published, I don't think we should do anything with it, but it's worth taking a look at. So this is another simulation experiment in which there's 2 mannequins. There's one mannequin that's able to generate a cough, and the other mannequin is able to inhale. So it's like having 2 people, an infected one and one that's exposed to the infected one. And what they showed in this paper is they looked at how many particles the mannequin would breathe in based on whether they had no protection, a medical mask, an N95 respirator, or a face shield. And what this paper showed, interestingly, was that the best form of protection was a face shield. You got the fewest viral particles inhaled. Again, this one was done at 24 inches. The 2 mannequins were 24 inches apart. And face shields were about 10 times better than medical grade masks. They did not use cloth masks in this study, but they used medical grade masks. And surprisingly, the face shield was even better than the N95 respirator. One of the concerns I think that people might have about this paper is they only looked at this one distance of 24 inches. What happens if it's further away? We just really don't know. The other thing I'm not showing here that comes out in the paper is that the face shield performed even better for the smallest particles, which is clearly not what we thought would happen. It's always been thought that the big droplets that come at you are ones that the face shield is really perfectly designed for. And people are worried about these very, very tiny particles that are so light in weight that gravity does not pull them to the ground and they remain suspended in the air. In this study, those types of particles, the face shields did even better. Again, this study needs to be peer reviewed before we can put a lot of weight on it. So what do we know? So we know that we have some data now that if we have a shield on an exposed person, somebody coughing at this exposed person, that there is some protection. What we have no data on at all is what happens if you put a shield on the infected person. Does that protect the exposed person? We don't know yet. Those experiments, they're actually underway. We're doing some of them here at the University of Iowa because we now have a cough simulator, but those studies we don't have data for yet. And then what we argued for in our JAMA paper was the situation of universal shields, or you could think of it as 2 dual shields. So you have a shield on the infected person, you have a shield on the exposed person. We don't know how well that works. We would assume that it works better than just having one shield on the exposed person if you have it also on the source. But those are experiments as well that will be completed hopefully in the next several months. There's been just a ton of debate in the medical community about whether people should wear shields or whether they should wear masks, whether this disease is transmitted by droplets or whether it's transmitted by aerosols. It's just an ongoing debate. And, you know, as I thought about this, I think it depends on what your vantage point is as to how you interpret the data. And so there's really two frameworks in terms of how to look at this. One is sort of a medical framework and one is a public health framework. And it's interesting for me because I play both roles. Sometimes I'm seeing patients, it's one-on-one, and sometimes I'm working as an epidemiologist and I'm worried about a population instead of a single patient. But, you know, as a physician, if a patient comes to me and says to me, how can I best protect myself? That puts me on the left side of this table because I'm working at an individual level with an individual patient. And in that case, your tolerance for risk is pretty low because most of the time the patient's going to say, you know, tell me what the best protection is, right? So the goal here is that I want to reduce that patient's risk to the irreducible minimum. I didn't say zero because I don't think there's ever zero, but the irreducible minimum. And so we're asking the question, how do we provide ideal protection for a person? And obviously it depends on the context. You know, I'm going to think differently about a 75-year-old person who's had her liver transplant and may have several other underlying conditions than I am a healthy 20-year-old. And so how I'm going to advise that person to wear their PPE would probably be different. Now, from a public health perspective, when you're looking at not an individual, but you're looking at a population of people, the questions become kind of different and your goals become different. The goals in this case are not necessarily to prevent every single case of COVID, but what you want to do is you want to stop the outbreak. And to stop the outbreak, you don't have to prevent every case, but you have to prevent enough cases to drive this number that you've heard of, the R0, to less than 1. Because we know from epidemic studies that when each person transmits to less than one person, the outbreak will stop. And so the question here is, how well does this intervention, whether it's a mask or whether it's a shield or which one you're going to use, what does it work? How is it working in the real world? Not how does it work in the ideal setting, but how does it work in the real world? So my conclusions are, in the hospital setting, we wear face shields, but we use them with face masks. And in the community, the situation, I think, is different. There are lots of states, including my own here in Iowa, where we don't have a mandate for any kind of face covering. So my feeling is, in the community, the best face covering is the one that you will wear. So I will stop there.
Great. Thank you so much, Michael, for that great presentation. Several questions have already come in, and I've got a whole bunch of questions as well. So just to remind everybody, for the Q&A, please use the chat box and either send it directly only to me or preferably to everyone, so we know which questions are coming in. And I'm assuming after we get through the ones that have already been submitted that way, and a few questions I have, we'll open up the microphones for people to be asking questions as well. So first, Michael, I think a really easy question for you. Will you make the slides available to the participants after this Zoom call?
Sure, I could just email them to Sean.
That would be great.
Yeah.
Another question was asked about what activities specifically generate droplets and which ones are worse than others. So we're well aware of coughing and sneezing being bad. I think sneezing being worse than coughing, but we're also hearing about singing or loud talking or jogging and exercising, breathing hard. What is kind of your pecking order in terms of worst to best in terms of activities that create aerosols and or droplets?
Sure. So they all create droplets and aerosols, but you're right, some are probably worse than others. I think talking at a normal level is probably one of the safer things. But things like singing are going to produce more droplets. We're more worried when people are exercising because they are taking deep inhalations and deep exhalations, and they produce more droplets when they do that. So singing, coughing, all of these things produce droplets and aerosols. There's really, nothing that humans do that doesn't, that involves our upper respiratory tract that doesn't do it.
And just to follow on to that, what is your understanding of the transmissibility of COVID-19 from especially young children under age 10? And if it's less than in older people, is that a function of just how much they breathe or anything to do with expression of ACE2 receptors?
Yeah, I guess I can't say that I have the answer to that because I've read conflicting things. There are some people who feel that the kid, because children don't breathe as deeply as adults, that they may be less infectious. I think there's other people who feel that kids. One of the issues with kids are they tend not to be sick, or at least very sick with this virus, and so they may be going about their normal activities while they're producing virus and infecting people. So I think we don't know all the answers to that yet.
You mentioned that you have a blog where you list all the face shields that are available. Yeah. How does one find that blog?
I can also send that to Sean, but the URL for that. But you could just simply Google my name and blog, and that blog will come up.
Okay. So maybe Sean, if you could do that, and then when you find the URL, post in the chat box, that would be terrific. Thanks. Then Michael, not surprisingly, a whole bunch of questions about schools. So maybe the first kind of overarching question to you, what do you see as being the best approach for face coverings in the school setting, and maybe break it down to grammar school, high school, and university?
Yeah. Let me just first say I'm not a pediatrician, and these are not the kinds of things that I think about much, but have been dragged into some of these discussions. I think I'll start with my last slide, which is the best face covering is the one that people will wear. So I think that for younger kids, they may not be able to wear a face mask or be willing to tolerate wearing a face mask. And if that's the case, I would put a face shield on them. I think it depends on things like the density of people in the room. If it's a very dense number of people in a room, the number of people per square feet is high, you might want to have a shield and a mask. The person who's talking versus a person who's mainly listening might play into this as well. There's no right answer to any of this, and we don't have the data. What we are missing is we have no studies like the studies that I showed you. We have no studies that where anybody has ever compared a shield to a mask. So we don't know which face covering is the best face covering. And then the other thing that I would say, and this is probably more for the parents of kids, and this goes with everything that we look at with regards to COVID and the type of PPE that you wear. The question becomes, what's your risk tolerance? And some people have very high risk tolerance. They're just not worried about it. Other people say, I want to do everything I can to prevent getting this. And so depending on where you fall in that spectrum, that will dictate to a great degree what you're going to do. Because if you really want to increase your level of protection, you're going to wear both a shield and a mask. If you're not as worried, you might wear one or the other.
And maybe this is a variation on the same theme. One person asked a question about teachers who are dealing with children with disabilities, and the children may not be able to wear a mask. They may not even be able to maintain a shield for long. And these teachers not only educate, but they also have to help with activities of daily living, including toilet issues and the like. So any recommendations or thoughts on kind of PPE in such a setting?
Yeah, so I think if specifically, if a child cannot wear a mask, I would try the shield, because their odds are they may be able to tolerate that better. So that's what I would do. I think for some of these kids, the ability to see the teacher's face and the facial expressions is really important. And in that case, the teacher may wear a shield as opposed to a mask. It may depend on the teacher's activities at the time, whether they're going to have one, the other, both. Again, no real right answer.
And I should, by the way, be ascribing the the names of the people who asked these questions. So that was from Amanda. Thank you. Any comment about the bulk cost of good shields?
They're typically not. I mean, they're all over the place. So if you buy the industrial shields, those are typically more expensive. So one of those could run you anywhere between $15 and $50. The lighter type shields, many of them are in the range of $5. And then that shield that I showed you from the engineers at Harvard sells for $1.
Great. Next question was from JD Davids. This is a question actually from me, but are you aware of, well, let me take a step back. So I am a drug developer. I've worked in the pharma industry for a long time. When we ever develop a pediatric formulation by FDA rule, you have to test the palatability, the acceptability of the drug with children. So you actually have to do field testing to make sure that they won't spit it up, that they can swallow the pill if it's a pill, or the syrup if it's a syrup. Do you know of any ongoing studies in terms of the just acceptability and effectiveness? Not so much in terms of blocking the virus, but just of being able to wear them, of especially young children, of masks and or shields?
I'm not aware of studies. I will say, interestingly, I gave a talk on face shields to the World Health Organization last week, and there was a discussion about children specifically, and it was interesting because from the various countries, the answers were quite different. There were countries that said that we cannot get any child under the age of 12 to wear a face mask. And there were other countries that said that every child under 6 in our country is in a face mask and it's not a problem. So I think there's some, the cultural differences that play into that, but I'm not aware of any formal studies that have addressed that.
I know I was on a call recently with folks from around the world, and they're talking about protective measures for adults. And a Dane said that in Denmark, it's culturally unacceptable that anyone wear any face covering, which was kind of surprised here, but it just underscores the fact that it's all culture specific, and it may even be subcultural in terms of any given country. I mean, certainly in America, we're seeing that, the South is different than the Northeast, is different than the Northwest, and everybody in between. So there's a lot of kind of cultural nuance to this.
Right, and it's also that may play into why Japan has such a low incidence of disease, because everybody wears a face mask there anyway, pre-COVID. And so there are some interesting observations, correlations that have been made that in countries that have high rates of wearing face coverings, there has been less disease than in countries that don't.
And a question from Sarah Kropp. Any comments about these new face masks that actually are clear in the middle where you can actually see facial expressions?
Yeah, I don't have any experience with them. I've been asked that question several times, and I've seen them. They show up on my Facebook feed quite frequently, but I haven't tried it myself.
And then the last question for me, and I know Sean has a bunch of questions as well, but do you have any comments about this report? I think it was actually just a lay media report about this outbreak in Switzerland at the resort where the people wearing shields were infected, whereas those wearing masks were not.
Right. So it is just a media report. I've looked at it. It doesn't say anything other than what you just said. There were 6 people who wore shields who became infected. So there's no report yet from the health authorities there in terms of a more formal investigation. It's interesting. I think what we know from the hospital, where we have everybody in PPE, when we see infected employees in the hospital, they have almost always been infected outside the hospital. And so you have to remember that people live a large part of their life outside of their work, and they may be doing things that put them at risk when they're not there. So until we have really good histories on each of these people, it's, I think, hard to interpret what it means.
Sean, you had a bunch of questions?
Great. These are some questions that were submitted beforehand, and as well as some that were just sent to me privately. One is about cleaning shields and how often that should be done. And
so as I mentioned in the talk, you can use almost anything, soap and water, any of the sprays that you have in your house. Many of them say kills 99.9% of germs. Those are fine. What's one good thing about this virus is that it's relatively easy to kill. So it's not resistant to most things that you try to clean it with. Ideally, you know, in the ideal world, you would clean your shield after each use. That may or may not be practical for you, depending on exactly what you're doing. There are some people that actually have several shields and they just rotate them, like one every 3 or 4 days. And then this virus only lives about 3 days. So that's another way that you might want to do it.
Great. Occupational therapists working with special needs students, asking who should be considered for wearing PPE or more extensive face protection. The district provides it to their nursing staff, but not yet for school therapists or other support workers.
I would assume that occupational therapists are in pretty close proximity to the child that they're working with. I think they all of them would need to be in some kind of facial coverings.
The slide you had on the paper that's not yet peer reviewed, question was what kind of shield and what kind of mask was used? Was it a cloth mask? Was a N95 shield enclosed, not enclosed?
So in that particular study, the mask that was used was a medical grade mask. It was not a cloth mask. They did use N95s as well. They compared medical grade masks to N95s to face shields. And the face shields, they did not give a lot of detail about the size of the shield or anything like that.
Okay. The shield you referenced, the shields that were open at the top allowed for droplets to come in from above. So that's a risk to the wearer. Shields that are open at the top, do they pose any significant additional risk to others around that person?
Probably not, because most of them come up high enough that the droplets that you're producing are being pulled down by gravity downward and not going upward. There is the potential probably for some aerosols to go upward. And we know that happens with masks, but no, I think that the bigger issue is the person wearing the shield that's open at the top, the risk to them.
Okay. Can you just say something about the sort of range in efficacy of homemade masks, from bandanas to, you know, the N95 is, I guess, screens 95% of whatever it is.
Right.
What might a bandana screen?
Right. So you're right. Of all the types of masks that you could potentially wear, N95s would be the most protective. And part of the reason that they're most protective is that they are sealed to your face really pretty tightly. You might have seen pictures of healthcare workers after they take them off and they have those big creases on their face. That's what N95s do, because they're so tight, but that's what makes them as effective as they are. Medical masks are considered to be better than cloth masks. The medical mask is made of a sort of a fibrous material that has an electrostatic charge to it that captures things that come through it. And in a cloth mask, you're just using plain cloth. And in the cloth masks, the protective effect of the cloth mask varies with the type of material that's used. So a more tightly woven material is better than a more loosely woven material. And then the other piece about the mask would be how close is it fitting to your face? If it has huge gaps, that's not going to be as protective. And I should say that no mask is protective if it's not over your nose and your mouth.
Right.
And we see a lot of people wearing them, on their chin or their nose is sticking out, et cetera.
Or as one friend just said the other day, they compared it to having the condom in the nightstand.
Yeah.
Not real effective there.
Right.
You detailed sort of a distinction between personal protection in a healthcare setting versus the effectiveness of everybody wearing masks or shields in community setting, and the kind of different standard for those two things. And the question was, which do you think is more appropriate for schools, for people in schools?
So what's different about healthcare settings is we intentionally create aerosols by the things that we do to patients. We put tubes into the respiratory tract to put patients on ventilators. We suction those tubes. All those things create aerosols. Worse than medicine, it's dentistry. Almost everything that dentists do, anything that uses what they call a handpiece, the drills, the water that they squirt into your mouth, all those things are creating aerosols. Dentists turn out to have the highest occupational risk for COVID, dentists and dental hygienists, of everybody, because of all these aerosols that are created. And so that's what's special about healthcare settings and dental settings is these aerosols. And that's if you're dealing with aerosols, you need an N95. And you also need eye protection. So we would wear an N95 with a face shield over top of that. A school is going to be much more like the community setting. So I would use community standards for that.
Okay. What would you wear if you go on an airplane?
Interesting. I did fly on an airplane a couple of weeks ago. I had with me an N95, and I wore that. I was lucky in that on all 4 of my flights, there was no one within 6 feet of me. I had a shield with me if I needed it. And I was really lucky on one of my flights, I was the only passenger. So I didn't worry too much at all.
So this is my question. Had you been seated next to people very closely, like right in the next seat, might you have worn the shield then?
Yes, I would. I would have worn both the N95 and the shield.
Yeah, that's what I meant, the shield.
Yes, yes.
Is a shield alone adequate for a group workroom in a hospital when you're not seeing patients, but there's an open work area and personnel's there?
Mm-hmm. So, yes, in our hospital, that's our policy. So our policy is when you're seeing patients, you have on a mask and a shield. If you're not seeing patients, then you need to have on one or the other is the way that we have crafted our policy. For our healthcare workers, most of them are in shields as opposed to masks if they're just in a workroom. We also have, this is something that has worried us a great deal because, in many hospitals, these rooms are relatively small. There can be several people in them. So we've gone into all these rooms and we've put a lot of plexiglass partitions, like on the table, so that people could all sit at the table and eat, but they're in their own space that's surrounded by plexiglass to give them more protection.
Okay. If you had only a mask or a shield, which would you pick?
I think it depends somewhat on the situation. In many situations, I feel very comfortable wearing a shield. So for example, if I'm going to the grocery store, you know, I'm not going to have people in real close proximity to me. I feel comfortable wearing a face shield in that setting. If I were in a classroom and there's, you know, 30 kids in a classroom, and it's not a very big classroom, I'd probably wear a mask. Fortunately for me, I wear glasses, so I get at least a little bit of eye protection from that, but I'd like to have a shield over that if I could.
Anything in particular that people living with HIV should be doing different than anyone else to protect themselves?
No, I don't think so. At least to this point, there's not been much written about different outcomes in people that are HIV infected. And so, and there's been some speculation that some of the antiretrovirals may have some protective effect, but that I have not seen, other than physicians writing into some spaces saying, you know, I just am not seeing very much COVID in my HIV patients. I have not seen any papers that have addressed that. But no, I don't think there's anything. I would take the normal, I would wear a face covering, but I think everybody should wear a face covering.
What's the difference between an N95 and a KN95, and the difference between construction grade versus medical grade 95s?
So K95s are a Chinese version of N95s. And the problem with them is that the strap design is different. So on a regular face mask, as you're probably aware, you know, the strap is going to come around your ears. On an N95 mask, the straps go around, they come around your head and around your neck. There's two straps. And that's what gives that very tight seal to the N95 is these two elastic straps. The KN95s don't have those straps. They have the ear loops, and they don't create a tight seal at your nose. We ended up getting some of them, and we did fit testing with them to see if we could fit them in the way that we fit an N95, and we were not able to fit anybody with a KN95. So I would consider KN95s to be like a regular mask. They are not really true N95s. Now, the next part of that question was about medical grade versus industrial grade N95s. From the standpoint of protecting you from the virus, they're the same. The difference for a medical grade N95 is it's fluid resistant. So for example, because we have, let's say you're wearing one of these in the operating room and you might get splashed with blood or something, you want the N95 to be fluid resistant. Some hospitals are using industrial grade N95s because there's a shortage of the medical grade N95s. So they can be used in the medical setting. But when they are, you want to have a shield in front of it so you're protecting them. But you can wear them, and if you can get them, I think that's fine. I don't think they're easy to get right now in hardware stores. I think they're pretty much out, but you might have had them from before.
So one more question transmitted to me privately, and then I'll turn it back to Doug. Air conditioning, heating and ventilation systems, how much of a risk does that pose? And what's the best thing to do if you're in an apartment building? And I guess it must mean, and that is controlled by the building or something.
So I think one of the things that most of the people who are experts in sort of aerosols and air movement, those types of things, and I will readily admit to you, that is not my area of expertise, but one of the things they say is having windows open is really good. Best of all is to be outside. Next best is to be inside with your windows open. The more the air is exchanged in a building, the better. It's the number of exchanges, how many times the air is being pulled through the ventilation system, mixed with clean air coming from the outside. The more of that, the better. And in commercial buildings, the HVACs can be set to increase that. And so if that can be done, that is a way to also reduce risk. And what they're talking about are these aerosols that might be these particles that are so small that they're just sort of wafting in the air. They don't have enough weight to them that the gravity would pull them down, and they're just sort of hanging in the air. Those can be removed through the HVAC system. And the more air exchanges that a room has, the better that is.
Doug, do you have other questions, or should
just a couple more? Well, first, a really good comment by Amy Beach is mentioning that young children down to age 2 with cancer are able to wear masks because they need to do it when they're receiving chemotherapy. So I thought that was a great piece of information, and it gives me hope in terms of our youngest. Another question, 2 people asked about more information regarding the $1 shields from Harvard. Can one access that through the Harvard website, or do you have a URL that we could use to find that?
So the URL is on that on the post on my blog, and the name of that particular product is called Dome Shield.
Great. Okay, thank you.
So
I had a question, and maybe this might take up the rest of our time, but in the early days of the pandemic, the initial communication from CDC and even NIAID with Tony Fauci was that the general population did not need to wear masks, and that masks would not help on a population basis. It helped in the healthcare setting, but not in the community. And then that messaging changed. My understanding of it is that some of the basis for the messaging in the first place were studies that were done with flu that predated SARS and MERS, and that you have a different reality in terms of community spread of seasonal flu or even pandemic flu than you do with coronaviruses. But if you could just comment about first what happened with masks and how do we avoid that happening with shields?
Sure. I never understood that recommendation. It never made sense to me. And the reason was because in the hospital, when we have patients in droplet precautions, and that includes patients that have influenza, that have various forms of bacterial meningitis, we always wear masks, and they are protective. And so I could not understand why CDC was saying that. They're apparently part of the reason, one of the reasons they didn't want a lot of mask usage was they were worried about retaining masks for healthcare workers. So they didn't want a lot of the medical mask supply to be out in the general public, but those be reserved for healthcare workers. And even early on, there weren't even it was hard to even find cloth masks at that point. So I can't defend, or I can't even explain why they thought that.
And is there any literature regarding face shields and influenza?
None other than that simulation study that actually used influenza virus. And then there is a newer study where they took about 50 people, and they divided them into 2 groups. And half of the people were experimentally infected with influenza. They put virus in their noses and they infected these people. And then the other half of the people were exposed. They had to sit in rooms with the infected people for 12 hours a day for 4 days. And the idea was to see who would catch influenza from the infected ones. And some of those people were allowed to wear shields, and some of them were not allowed to wear shields. And what they found was that only in the people with shields, no one got infected. And in the people that didn't wear shields, 1 person got infected. So it was the number of infected in both groups was extraordinarily small. And so there wasn't really a whole lot of conclusion that they could make about that. But that's the only other study that I'm aware of.
Okay, great. I don't think there are any more questions coming from the chat room. We only have a few minutes left. I don't know if we want to open up the mics for people, or if people want to raise their hand through the hand raising function, or it's the last chance for someone to put a question into the chat room for Dr. Edmond.
So put it in the chat room, or go ahead and do the raise your hand thing.
So in the chat room, there's a question: would UV lighting in public spaces help?
UV lighting in general is a good thing. The issue is it has to be done so that it doesn't harm people. Yes, and in fact, we use it in the hospital when we do terminal disinfection of patient rooms.
So just on that point though, so it's only one form of UV light, so it's the C band of UV light, and it's quite toxic. So you'd have to do it, you could use it to cleanse after, but the people couldn't be in the room. And unless you use a special technique, it only disinfects the areas that are in the direct line of sight of the light. Of course, by definition, that would be the case. There is a way to kind of disperse it differently, but it's really good for surgical operating theaters where you can just remove everything and then blast all the walls and floors and ceiling. And
that's what we do when a patient leaves. When they're discharged from the hospital, we take the robot in that produces UV light and we do the room, and nobody's in the room when that's occurring.
And maybe this is the best last question. Do you think schools should be opening? The question is specific to New York City, but do you think that schools should be opening? Again, maybe break it down by grammar school, high school, universities.
I don't think it makes a difference, to be honest with you. I just can't see any way that schools are going to be open more than 2 weeks. I think that in area, I mean, unless it's an area where they really have a very, very low incidence of disease, I think you're going to see cases. They're going to start quarantining people. The teachers are going to be quarantined. The students are going to be quarantined. And I think the whole thing's going to fall apart. So maybe I'm too pessimistic about this, but I just don't see it happening.
I saw a report today of what happened in Israel. So Israel had 1/30 the per capita daily transmission rate of the US when they reopened their schools. And within 2 weeks, they had to close all their schools because there were massive outbreaks.
Right.
So question, back to the ventilation. And of course, there's a huge difference in buildings. You can have rooms that are entirely sealed, whether schools or elsewhere. How effective would it be to have fans at exits and sucking the air out to outdoors or pushing air in from the outdoors?
Yeah, I don't think I should answer that question because I don't really know the answer to that.
Okay.
I think it depends on where they're positioned is one of the issues. So I don't know.
Okay. Another question here. Do you think that it would make sense to have in-person schooling only for the younger children who have a bigger issue in terms of telelearning, and that you have all of the older kids free up the space by learning from home?
So anything that you do that reduces the number of kids in the building is good. So that's better than bringing all the kids back. Yes. I think you see these arguments about that kids don't get very sick, therefore we should do it. We should have school. But, kids don't live in a world by themselves. They're going to expose their parents, their grandparents. They're going to expose people that have underlying conditions who could have something bad happen to them if they get COVID. So, yes, I think it would be better to reduce the number of kids in the building, but I think it'd be better if there weren't any. That would be the safest.
Question about outdoors. If someone is outdoors and not wearing a mask or a shield and 6 feet away, is that a concern? But how about sitting at a dinner table outdoors without wearing masks and shields, where you might be only 2 feet away from somebody?
Right. So I would be concerned about that. If you're not 6 feet away, that's a problem. 6 feet might not even be enough depending on what you're doing. If you're running and you're breathing deeply, you're producing droplets. They're going to be going more than 6 feet. Some people say in that setting it should be 10 feet. So I would argue that people should probably still be in a mask anyway if they're around other people when they're outside.
And okay, to what distance?
At least 6 feet, at least.
Okay. All right. We are 2 minutes past the hour, and it looks like we don't have any more questions, which is great. So I want to thank Dr. Edmond and Dr. Mannion Appreciate it so much. We will send this recording and the information on the website, which also has the information on where to buy masks, which a number of people have been asking about. We'll send that out to everybody probably tomorrow, and you're welcome to share it. And we all look forward to learning more as the research base around all this grows. So thank you so much, and thanks to everybody for joining the call.
Thank you.
Okay.
Thanks, everybody.
Bye-bye.
Thank you.
Thank you so much.
You're welcome.